Welcome back to the Forum on this Sunday morning. Thanks for sticking with us. I'm Asa Stakel. Our second guests are here to talk about a student-run pharmacy. And this summer, Albany College of Pharmacy opened a new pharmacy inside the Whitney Young Health Center in Arbor Hill. It's a new home for the College Parkside Pharmacy, a standalone student-supported pharmacy which was opened back in January 2017 in Albany's South End. Now we have Dr. Greg Dewey, who is the president of the college, and Dr. Theodore Zeltner, who is Whitney Young Health's Chief Medical Officer. Thank you both for coming in.
Welcome.
Thank you. It's great to be back.
Yeah, and it's good to have you back. It's always so interesting to hear about what pharmacy and health science students are doing nowadays because it seems to be always changing.
Absolutely.
So back in 2017, we covered this when you opened up the initial pharmacy in Albany. Why did you decide to make this transition to Whitney Young?
When we opened up that pharmacy in the South End, that was a freestanding pharmacy, so it was more akin to a independent pharmacy, and we were always hoping to have some level of clinical services at that pharmacy because we feel that the future of pharmacy is really about integrating the practice of pharmacy with the practice of medicine, where people work in professional teams, and the really value of a pharmacist is really working alongside the doctors. When this opportunity arose with Whitney Young, where they needed pharmacy services in Whitney Young, we saw this as really building on a great partnership. We had a long-term relationship with Whitney Young. We always had a clinical pharmacy faculty member in the Whitney Young Clinic, but it was a chance to not only continue dispensing in this underserved population, but really interacting with the medical team at Whitney Young to really integrate that.
And Whitney Young, this made sense for you?
It makes perfect sense for us. I think that having the pharmacy on site offers a great benefit to all of our providers as well as the patients. We have a full-time pharmacist PhD on site whose job it is to help us with difficult situations, for instance, discussing medication regimes. One of the things about Whitney Young, of course, is our patients are very ill much of the time. We do have a mission to serve the underserved population, although we're open to everyone. But many of our patients have multiple illnesses on multiple medications, which leads to potential side effects, and also the question of what's the best regimen for a patient to be on. And so this resource person can make rounds with us. We can have them go over medical programs, make suggestions as to what the best regimen would be, and it's been a great asset to our providers.
Now, I read that the college's history with Whitney Young Health stretches back nearly 50 years when you hired your first adjunct faculty member who was working there.
Yeah.
What's the history of Whitney Young Health?
Well, Whitney Young Health started in 1971 and over the years has grown to the point where now we have multiple subspecialties on site. We also have mobile units that go to schools in several cities. So we're pretty diverse in providing health care to a great number of people in the area.
So in the few months that this partnership has been going on, this new student-run pharmacy partnership, what's it been like for you guys?
Well, it was really a lot of activity early on. We got it launched July 1, and getting all the regulations, getting all the forms filled, getting the inventory in. It was a lot of work up front.
I can imagine,
and, but it's paying off. The level of activity at Whitney Young in that pharmacy is just astounding. It is a hopping place, and we have students working there. We have staff there. Again, we have the licensed pharmacist that oversees it. We have a faculty in the clinic, and you just go in there, and it's just like this. It's constant activity, and you know, one of the things about Whitney Young, it's a federally qualified health center that's really dedicated to underserved, medically underserved population. And as Ted said, you know, these people have complicated problems, and that have often gone unmet for a while. So, you know, we have to wrestle with the complexity of that, and that is an experience you cannot give the students in the classroom. There's nothing like having the immediacy of a person in front of you with some unusual need that you have to solve. You can't simulate that, and it is absolutely a great experience for our students, and it teaches them in some ways the future of pharmacy. The future of pharmacy is taking a bigger role in the practice of medicine, getting closer to a provider, and more integrated into the medical team. So this is kind of a win-win all around for us.
And I think the other point, too, is it gives the providers a much better chance of interacting with the pharmacist directly. If I have a question, I can walk across the hall and speak to the pharmacist. We don't have to play phone tag trying to reach each other. If the pharmacist has a question, they can page me, and I can be on, if it's dealing with one of my patients, I can be on the phone in 30 seconds with a pharmacist explaining what I want to do, and if he has any suggestions, you know, we're certainly happy to hear them. I think integration is the key here, and it's, as most people know from reading, pharmacy costs are one of the major costs in medicine that have been rising. There's a lot of talk on the national scene about pharmacy costs today, and working together, we can try to mitigate some of those and pick the best regimens at the least expense, for example, which saves the patients money.
Do you think we see more integration like this throughout the industry in the future? Is that what you're talking about when you say the future of pharmacy?
Absolutely. We're going to see, the whole trend is to work in interprofessional teams where a nurse practitioner, a physician, a pharmacist, a therapist work as a team working on a person's problem. So this is what we call value-based medicine as opposed to a fee-for-service. You know, historically, pharmacy has been a fee-for-service. You have a prescription, you fill it, and you collect the fee for it. This is moving us into value-based medicine, where we're really looking at more of a fee-for-cure, and you get everyone working at the top of their profession in these teams, so the physician doesn't have to worry about, you know, I have to look up which drug to order here, which drug is cheapest. You know, they refer to the pharmacist and pharmacist. So everyone adds to the value of the practice, you know, in this integrated team. That is the future.
How helpful is it as a physician to be able to speak to a pharmacist?
It's very helpful, picking the right agent, avoiding potential side effects, noting the cost. There's some, for instance, drugs where you can use one form of the drug that's immediate acting and another one that may be long acting that costs 5 times more. When is it necessary to use which in which situation? And we know as providers generally what we want to do and what we should be doing, but there are very complex interactions between drugs where it's helpful to have the pharmacy knowledge, where we can ask somebody, you know, what do you think about this, or what do you think about that, and get a good interchange back.
So the other thing pharmacists can really do is counsel patients too, on the use of their medication. You know, there is one of the biggest problems is compliance. People don't understand the importance of staying compliant with the regimen of the dosages, and they'll say, "Well, I feel pretty good today. I'll skip a day." That's a really bad thing to do.
Yeah.
Or I missed yesterday. I forgot about yesterday. I'm going to take twice as many meds
today.
Not
good either.
Yeah. So that counseling service, and as Ted said, you know, some are long acting, some are short acting, and really understanding if you're on multiple regimens, that drug-drug interactions can be very negative, and a pharmacist can unravel that, and sometimes it's just a modest change to the regimen can really create a lot more comfort for the patient. So that personal counseling is an important component as well.
You were telling me about the curriculum for a pharmacy student before. In their final year, they do rotations, and they could do them with a CVS in Clifton Park. Right. What do they get out of working at a clinic that serves an underserved population?
Yeah. So, that's a great question. You know, in a way, the scope of practice for a pharmacist is a little broader in that setting, that we have opportunities to do more things, and we can, the counseling can have a bigger impact, and it's the complexity of that problems that you face in these populations. But, you know, it's also the feeling that the students are getting social benefit. They're giving social benefit.
Right.
And they find it incredibly rewarding. And some of them, it flips their career. They decide, you know, I never thought I would want to work with a underserved population, and now this is for me.
Wow. And that's happened before?
That has.
Wow. That
happened early on at a few students. So it can be a very eye-opening experience for these students.
The other thing, it allows us to offer special programs. For instance, Whitney Young now is a participant as a federally qualified health center in what's known as the Million Hearts program, looking at refractory hypertension. We know, for instance, in America that over 1/3 of hypertensive patients are not optimally controlled. And so there's special efforts, especially when they have a number of other, what we call comorbid conditions, other things that can affect the pressure, and which added to the pressure makes it more dangerous. So we have a grant, and we're studying, and one of our goals is to have the pharmacy people look at some of these refractory cases where these patients are very hard to control and make the appropriate suggestions. Many of our patients are on 10 or more medicines.
Wow.
And it's great to have the pharmacy review those programs and make suggestions as to how they might be streamlined and how we can cut down on some of these medications and get the same benefit. So it's really a mutually beneficial relationship,
Yeah.
I would say.
When you have a patient on 10 meds, and actually if you go in a nursing home, you'll find them on as many as 30.
Wow.
But if you think about if each drug has a potential to interact negatively with another drug, that's a lot of interactions.
Yeah.
And so this is what I say about the complexity. So we have something called medication therapy management, which is what our pharmacy students learn. It's just how to manage that whole regime, and in some ways you want to even think about how do you back off some of this. Do you really need that 10 medication? Can you sort of systematically try to tune that down? And you know, so they're getting a real life experience applying what they're learning in the classroom here. So
wow. When you have someone come in who is on 10 medications and it's just a pharmacy student, this could be very complicated for them.
Yeah, yeah.
How much oversight, how much guidance do they get?
Well, they always will have either the faculty member who is assigned to Whitney Young, or they will have their licensed pharmacist looking over their shoulder and giving. But I always say our students are our greatest asset. They are problem solvers, and they don't say, well, that's not my job, I'm going to put that aside. They really work with people, and they try to solve their problems, and they, of course, have the backup of the medical team to help them. It's just a superb learning experience for them.
Is the pharmacy self-supporting, or where does the funding come for that? This?
So when we started the pharmacies, we launched them based on philanthropy, but we view this as really kind of a venture in social entrepreneurship, because, you know, we're creating social capital here by our work in the inner cities, but we want them to be sustainable businesses on their own. And We are in our 4th year. We have one in Schenectady. At the other, there are 2 FQHCs in the region, Hometown Health in Schenectady and Whitney Young, and we're providing pharmacy services at both of them. And the revenue we get from filling prescriptions is now at the point where we break even.
Wow.
So
and that's the goal, right?
We had a 5-year plan, and we're in year 4, and I think we'll get there. So it is a sustainable business, and it's good for the students to see that as well. Some of them may go into independent pharmacy. They need to know how to run the pharmacy as a business, and they'll see the sort of the back office operations. So that's an added benefit.
Is this helpful for patients if they can get their pharmaceuticals right there at their doctor's visit?
It's very helpful. In fact, we have many patients who will say, can I fill my prescription here today? Because it's quick, it's easy, and we say sure, and it's a great help to them. Also, the pharmacy helps by running certain other programs. For instance, the pharmacy itself has a blood pressure program where patients can get their blood pressure taken right there. They're given a card, they're monitored, and the pharmacist then can look at the results and make recommendations, or let us know to say, gee, your patient had his blood pressure checked 3 times in the last month and he's really not at the goal you want, which gives us a signal that we have to change the medical program.
So this is another thing. Is when I say expanding the scope of practice of pharmacists, they can do some of these things, relieve the physicians from taking, having to take some of these routine diagnostic tests, and the pharmacists can do that. We can immunize. A few years ago, people thought, oh, you can't have pharmacists immunizing. Now it's routine,
right.
And so they are a highly educated health profession that is probably the least utilized in terms of the type of educational level that folks have, but they can do many of these diagnostic things and relieve the burden from the physicians, become a more efficient operation, and really serve the patients better.
And then we have about 30 seconds left. We're running out of time. But the old location on 20 Warren Street,
right.
What's happening to that?
So we have another facility called the Collaboratory. That's another operational.
We've talked about that before, I think.
Yeah, the Collaboratory, we're integrating pharmacy services with social services, and so here we have pharmacy services and medical services. In the Collaboratory in the South End, we have pharmacy services and social services, and that's up and running, and that is really going to be the hub in the South End. It's a stone's throw from where the pharmacy was, and we will be delivering, also have a delivery service from the Whitney Young into the folks in the South End. So we haven't given up on the South End. We still are working down there and doing great things with the Collaboratory.
Good to hear. Well, Dr. Dewey and Dr. Zeltner, thank you both for coming in.
You're welcome.
Okay.
Thanks for having us.
Absolutely. That's it for the